Welcome back to my channel Mis.Medicine. If you are new here, subscribe to the channel. In this video, we will discuss about Combined Medical Services Examination 2020 Paper 2 Part 1. So let's get into the video. Question number 1 is indications for fasciotomy in compartment syndrome includes all except. The answer is palpable distal pulses, and indications for fasciotomy in compartment syndromes are distal sensory disturbance, compartment pressure more than 30 mm mercury, pain on passive movements of affected muscles. Next question, which one of the following statements is not correct regarding necrotizing soft tissue infections? The answer is they are monomicrobial in nature. Next question, which one of the surgery is laparoscopic cholecystectomy classified as clean contaminated? Next question, a 22-year-old female has presented with a history of malaise, cough, alternating constipation and diarrhea with intermittent abdominal pain for last 6 months. She also complains of abdominal distension for 2 days. On examination, her abdomen has a duffy feel along with an ill-defined mass over the right lower quadrant. She is most likely suffering from ileocecal tuberculosis. Next question, consider the following statements regarding needle stick injuries. The answer is injured part should be washed under running water. All needle stick injuries should be reported, and hepatitis HIV testing should be done after needle stick injury. Next question, consider the following statements regarding claudication. It is a marker for silent coronary disease. Structured exercise program 2 hours per week for 3 months leads to improvement in symptoms. Diabetes mellitus increases the risk and severity of claudication, and beta blockers may exacerbate claudication. These all are 4 options are correct and true regarding claudication. Next question, a 50-year-old lady underwent uneventful bariatric surgery for morbid obesity. On this third post-operative day, she develops breathless and pulmonary embolism is suspected. The investigation to confirm the diagnosis will be CT pulmonary angiography. Next question, medical management of thyrotoxic Next question, medical management of thyrotoxic crisis includes all of the following except IV antibiotics. And medical management of thyrotoxic crisis, we can prescribe and we can give IV fluids, IV propranolol, which is beta blocker, and IV hydrocortisone. Next question, a patient operated for a parotid gland tumor developed symptoms of sweating and erythema flushing over the region of surgical excision while eating. The probable diagnosis is Frey syndrome. Next question, first-line hormone therapy for postmenopausal women with metastatic carcinoma breast is anastrozole. Next question, all of the following are major subtypes of breast cancer based on gene array analysis except estrogen receptor positive, and major subtypes of breast cancer which based on gene array analysis are luminal A and luminal B, triple negative, and HER HER2 receptor positive. Next question, all of the following are sequelae of peptic ulcer surgery except. The answer is increased appetite. And sequelae of peptic ulcer surgery are bilious vomiting, dumping syndrome, and diarrhea. Next question, the child Turcotte-Puig score for quantifying the severity of chronic liver disease includes all variables except serum creatinine, and child Turcotte-Puig score for quantifying the severity of chronic liver disease includes serum bilirubin, serum albumin, and INR, which is international normalized ratio. Next question, chain of lakes appearance due to circulation with intervening short structures of pancreatic duct is seen on ERCP. Which one of the following statement is not correct regarding pyogenic liver abscess? The answer is treatment is with oral antibiotics alone. And next question, Swiss cheese defects are seen during laparoscopic repair of ventral hernia. Next question, which of the following are correct regarding splenic artery aneurysm? Main arterial trunk is the most common site and it is symptomless unless it ruptures. Next question, Valentino's syndrome is pain in right iliac fossa in perforated peptic ulcer. Next question, spontaneous bacterial peritonitis occurs due to acute bacterial infection of ascites. Next question, structure not forming boundaries of the triangle of doom seen during laparoscopic inguinal hernia surgery. Dissection is inferior epigastric artery. Next question, the term midline shift is associated with head injury. Next question, which one of the following cranial nerves do not supply to the external ear? The cranial nerve, 6th abducens nerve, and the cranial nerve which supply to the external ear are cranial nerve 5th, cranial nerve 7th, and cranial nerve 9th. Next question, left internal mammary artery LIMA has become the conduit of choice for left anterior descending artery during coronary artery bypass grafting because long-term patency rates are more than 98%. Next question, a 50-year-old male with significant smoking history presented in the surgical emergency with sudden severe breathlessness. Chest X-ray shows right-sided pneumothorax. The appropriate management requires right chest drain of size 8 to 14. Next question, which one of the following statements regarding Fallon is not correct? It is painless condition, and the correct statements regarding Fallon are: there is infection of the fingertip between specialized fibrous septa. Incision and drainage is a treatment of choice and it is common in diabetes. Next question is, the most common site for osteosarcoma is distal femur. Next question, rapid sequence induction is indicated in emergency surgery for intestinal obstruction. Next question, which one of the following statements about compartment syndrome is not correct? Pain is in active movement but not on passive movement of muscles. Next question, which one of the following is not the strength of ultrasound as a diagnostic modality? The answer is short learning curve. Next question, which one of the following statements regarding lymphedema following breast cancer treatment are correct? Incidence has decreased due to rarely combined therapy of axillary lymph node dissection and radiotherapy. The condition is often painful and edematous limb is susceptible to bacterial infection. Next question, which one of the following is not a risk factor for development of venous thrombosis in surgical patients? The answer is diabetes, HbA1c more than 7.5. And the risk factors for development of venous thrombosis in surgical patients are age more than 60 years, pregnancy and obesity, who have BMI more than 30 kg per meter square. Next question, which one of the following is not a complication of massive blood transfusion is hyperthermia, and complications of massive blood transfusion are coagulopathy, hypocalcemia and hyperkalemia. Next question, stage 3 pressure sore is full thickness skin loose extending into subcutaneous tissue but not through fascia. Next question, during subclavian vein rupture. Next question, during subclavian vein puncture in a surgical ward, suddenly a patient developed severe breathlessness. On auscultation, breath sounds was absent. The ipsilateral chest was tympanitis on percussion. The probable diagnosis is iatrogenic pneumothorax. Next question, Kohler's disease is avascular necrosis of navicular. Next question, which of the following is not true of pyoderma gangreosum? The answer is cultures often show gram-positive staphylococci, and the pyoderma gangreosum is characterized by cutaneous ulceration with purple undetermined edges. It is often secondary to heightened immunological reactivity from another disease process, and lesions generally respond to steroids. In pyoderma gangrenosum. Next question, which one of the following is not a true repair surgery for inguinal hernia repair is Stoppa's repair? Next question, which one of the following type of meshes is recommended for intraperitoneal use in abdominal wall hernia is tissue separating meshes? Next question, which one of the following is not correct regarding Meniere's syndrome is it involves pineal gland? Meniere's syndrome involves parathyroid gland, it involves pancreas and it involves pituitary gland but not pineal gland. Next question, which one of the following is not an electronic information site in surgery? Is National Medical Library, and electronic information site in surgery is PubMed, Embase and Cochrane Library. Next question, which one of the following statements regarding preconceptional counseling is not correct? It is needed only in selected complicated pregnancies. Next question, consider the following statements regarding non-stress test. It is reactive non-stress test indicates a healthy fetus, and non-stress test has a low false negative rate less than 1% but high false positive rate more than 50%. Next question, which one of the following is a protective factor for endometrial hyperplasia is diabetes? Next question, a woman who is not breastfeeding her newborn child is advised to use a contraceptive method by third postpartum week. Next question, Pearl index for contraceptive effectiveness is calculated in terms which of the following? The answer is pregnancy rate and 100 women years. Next question, indications for removal of IUDs are all except cyclical menstrual bleeding. Indications for removal of IUDs are perforation of uterus, flaring up of salpingitis, which is inflammation of the fallopian tubes, and pregnancy with IUCD, which is intrauterine devices, which is a contraceptive method to prevent pregnancy. Next question, contraindications for insertion of IUDs are all except during cesarean section and insertion of IUDs. We can insert IUDs in the suspected pregnancies, trophoblastic disease, and in severe dysmenorrhea, which is painful bleeding. Next question, which one of the following is not a contraindication for use of mini pill is breastfeeding? Next question, which one of the following is the most common used surgical method technique of female sterilization as recommended by Government of India is Pomeroy's method. Next question, which one of the following are required for registered medical practitioner to qualify for performing medical termination of pregnancy as per revised rules of MTP Act, diploma or degree in obstetrics and gynecology? Next question, which one of the following is not a support of uterus preventing its descent? The answer is inguinal ligament. Next question, as per ICMR guidelines, which one of the following statements is true regarding effects of COVID-19 on fetus according to current evidence? The answer is COVID-19 virus is not teratogenic. Next question, as per ICMR guidelines, which one of the following statements is true regarding COVID-19 infection in pregnancy? Pregnant women with heart disease are at higher risk. Next question, which one of the following is not a method of management of deep transverse arrest with the living fetus? The answer is delivery by application of forceps to the unrotated head. And the management of deep transverse arrest with the living fetus are cesarean section, delivery by ventouse, and manual rotation and application of forceps. Next question, successful version of breech presentation is likely in case all of the following except breech with extended legs. Next question, implantation of a fertilized ovum occurs on which day following fertilization? Day 6. Next question, during total abdominal hysterectomy or the ureter is likely to undergo injury or ligation during the following steps except during division and ligation of the round ligaments. Next question, the net effect of antenatal care has been following except reduction in the incidence of institutional delivery. Which one of the following is not a component of active phase in the partograph, phase of expulsion, and component of active phase in the partograph are acceleration phase, phase of maximum slope, and phase of deceleration. Next and the last question for this video is from medico-legal point of view, which one of the following is not a sign of previous childbirth? The answer is conical cervix with round external os.